My name is Hannah Brown, and I'm graduating from NYU with a major in Spanish on the pre-medical track. This is a presentation of the research I conducted for my honors thesis, Pretend I'm Not There, but Remember That I Am, Medical Interpreters as Members of the Healthcare Team, and the Effects of COVID-19. Medical interpreters facilitate communication between patients and medical providers. They not only translate the words of each party, but also act as cultural brokers, bridging cultural divides between patients and providers. They ensure that meaning is retained in each language and the sentiment of the message is understood. In conducting my initial literature review, I found that the majority of past research analyzed patient and provider opinions on the use of medical interpreters or quantitatively measured the accuracy of interpretation. But there was a critical voice missing, that of the interpreters themselves. I set out to understand how interpreters view their own roles and responsibilities, and what they uniquely bring to the healthcare encounter. I created a questionnaire to use as a guide in individual hour-long interviews with Spanish to English medical interpreters. After receiving approval from NYU's Institutional Review Board, I emailed this flyer to language services offices at hospitals throughout the country, as well as to individual interpreters I found through listservs. I ultimately interviewed 21 Spanish to English interpreters virtually via Zoom. After analyzing my interviews, my primary conclusion is that medical interpreters are, in fact, healthcare workers and should be seen as part of the medical team. This idea has not, to my knowledge, been explicitly put forth by any previous research. Additionally, it is clear from my interviews that COVID-19 both increased recognition of interpreters' crucial contributions to medical care and led to medical providers including them more in the healthcare team. I will briefly outline testimony from the interpreters I interviewed that exemplifies this, and then discuss how to ensure that this progress remains even after the pandemic. According to my interviewees, the pandemic really emphasized how crucial interpreters are to patient care. Interpreters went out of their way to care for their patients, often standing right next to them, to make sure they could hear over the loud ventilators, even though it was dangerous to be so close. One woman recounted a time in April 2020 when she was caressing a COVID patient who was being intubated. In her words, though nurses were looking at her like she was crazy, "I was thinking, this patient doesn't have family. He was undocumented. We didn't know if this guy's gonna make it. I'm the last person he's gonna see. I'm gonna hold his hand." And I held his hand as he was intubated. In one interpreter's hospital, it was often the interpreter's responsibility to make sure patients did not die alone, whether that meant virtually connecting them to a loved one or personally sitting with them while they died. Another interpreter described a devastating moment. "We had a patient who was going to be intubated, and the patient was trying desperately to reach their loved one before they got intubated, and they were unable to. And as soon as they finished intubating, the loved one called, and the nurse picked up the phone and said to me, 'Speak to them.' So I had to speak to them and just tell them what the patient had said they wanted to tell their loved one. I thought, I have to express exactly what he said right before he was intubated, because they may never hear his last words, and I may have been the one who heard those last words." Now more than ever, patients' stories, feelings, and thoughts are being filtered through interpreters. Beyond simply facilitating communication, it has become the interpreter's responsibility to make sure patients' voices get heard and sometimes even carry on their memories. Past research has found that interpreters greatly improve patient care, but I am taking this one step further and introducing a novel idea: to reframe medical interpretation as a medical profession and view interpreters as clinical healthcare professionals, as essential to patient care as nurses or doctors. So, how do we do this? First, there needs to be a large-scale change to medical interpreter training, not only making it more standardized, but also including aspects that specifically prepare them to be medical professionals. At the same time, providers need to be trained on how to work with medical interpreters and integrate them into the healthcare team. Such training could start as early as medical school. Finally, hospitals should staff interpreters around the clock, which is not commonly done, and enforce the practice of pre-sessions and post-sessions, in which providers meet with interpreters to discuss a patient's case before the healthcare encounter and debrief with them afterwards. One major result of this paradigm shift would be an increased quality of care for patients who don't speak English. For example, interpreters noted that pre-sessions help them better understand a patient's situation and background, and therefore provide more informed care. And during post-sessions, they can explain any cultural misunderstandings that may have come up and help the provider be more culturally aware next time. Medical interpreters have historically been overlooked in research on American healthcare professionals, but to fully understand the dynamics of any healthcare encounter, one must categorize interpreters as healthcare workers due to their unique contributions to the medical care of non-English speaking patients, as outlined in my research. Please don't hesitate to contact me via email if you have any questions or would like to discuss this topic further. I would also be glad to share a copy of the full thesis. Thank you.